Good evening, everyone. I would like to call to order this Tuesday, April 15th meeting of the Bucks County Intermediate Unit Board of Directors. Could we all please stand for the Pledge of Allegiance?
One.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning, boys and girls.
And just for your knowledge, that was a class at the Benjamin Rush Elementary, and it was the pre-K counts class. Okay. Michelle, would you do a roll call for attendance, please?
Yes, Mr. D'Angelo,
Here.
Mr. Jackson,
Here.
Mr. Hollowell,
I am here.
Mr. Morgan, Miss Sheehan, Miss Stern, Mr. Waldorf,
Present.
Miss Winters,
Present.
Mr. Wers,
Here.
Miss Osecki,
Here.
Miss Walbeezer,
Here.
Mr. Godikson,
Present.
Miss Foley.
Present.
Wonderful. We have a quorum of 10.
Okay. Moving right along, we did have an executive session that began at 6 o'clock, and we discussed real estate and personnel matters. So moving on to our presentations and mini reports. This will be the Bucks County Schools, the BMCS mini report 2024 year in review.
Great. Good evening, everyone. April's always very exciting. April 15th is always very exciting, not because it's tax day, but because I get to talk to you about the Bucks and Montgomery County Schools Healthcare Consortium. You all know that I am a big cheerleader for the Healthcare Consortium. Bucks IU is a founding member of the Healthcare Consortium. I currently serve as the chair of the consortium. Every year, labor and management switch roles. Next year, the chair will be a representative from PSEA. Usually it's Bill Sinovitis, who currently is the president of the Mid-Eastern region of PSEA. And he and I just switch off every year. I always offer if anyone else wants to chair it, but this is our annual wrap up to give you background on what we've been discussing this year. So let me get into it. We're going to talk about highlights, why it makes sense to belong to a consortium, particularly with the healthcare trends that we have going on right now in the state and across the nation. Who we are, why you should choose us, what some of our points of pride are, the overwhelming savings that we've achieved from being in the Bucks and Montgomery County Schools Healthcare Consortium, and then a little bit about our trustees. I'm gonna not take too long on this, but I wanted to give you our mission statement. We spent some time early in the year updating our mission statement, and we found that this really helps us because we're labor and management working together. And we found having a core mission statement really helps us sometimes when we make tough decisions to go back to our mission statement and remind ourselves why we're doing what we're doing. So our updated mission statement, which was approved early in the year, is the Bucks and Montgomery County Schools Healthcare Consortium consists of public school entities in Bucks and Montgomery counties. Labor and management have joined together in a unique self-funded arrangement as a large group purchaser of medical insurance, prescription drugs, and other employee benefits. The mission of the consortium is to provide access to high-quality health care for our members in the most cost-effective manner possible. We collectively strive to improve health and wellness for our members through transparency and education. And you see our 5 pillars of core values underneath that statement. Here's summary highlights. If you remember nothing else from tonight, this is the slide I want to be your takeaway. First off, our healthcare consortium has saved our participating school districts. Currently, there are 12, more than $94.8 million since inception. And we were founded back in the 2012-2013 school year. For the Bucks County Intermediate Unit, hold on, there we go. Our projected 25-26 annual combined medical and prescription drug increase is 8.2% compared to the national annual trend of 11%. However, because we have been so cost effective, we have accumulated reserve funds in our individual entity account, and we were able to decrease this 8.2% trend to 5% for next school year, which is what we had budgeted in the IU budget. Our annual savings from being a member of the healthcare consortium for administrative fees. So that's what we pay our third-party administrator, Aetna, for our medical claims and prescription drug claims through Capital RX, is a combined savings for the IU of $341,365. These are savings simply by being a member of the consortium. We achieve these because we have contract clauses with both Aetna and Capital RX that they will honor, giving us the lowest administrative fee for any municipal entity in the state. And if they give a lower administrative fee, the contract clauses say they automatically have to give them to us. Our annual savings in stop loss premium for the Bucks IU is $192,828. This is because we are self-funded for stop loss up to $550,000 through the healthcare consortium. We save almost 40% over market share by being self-funded for stop loss through the consortium. Over 550,000, we do go out to open market to cover losses beyond that. And then in summary, for this school year, we have saved $633,045 in administrative fees and stop loss premiums simply by being a member of the healthcare consortium. So that's the slide I want you to remember, right? Here's just some other highlights for you. Why does it make sense as a school entity to join a consortium? First off, you get large group purchasing efficiency by being a member of a healthcare consortium. Instead of being treated as an individual entity, you are treated as part of a large group purchasing cooperative. Secondly, our stop loss pool. We are the only entity in the region that has a self-funded stop loss pool. We have achieved that by working together with labor to get agreements to allow us to have this self-funded stop loss pool. What does that give us? That gives us a savings of over 40% over on the open market for stop loss. We get actuarial oversight. We have an excellent third-party consultant, Oswald, based out of Cleveland, Ohio. They are just fantastic with the actuarial oversight they provide, the risk analysis they give us. They make sure that our finances are in order, and then they provide amazing data analytics for us. They take all of our claims and they will let us know who our high-cost claimants are, not by name, but which school entity has high-cost claimants, what those high-cost claims are about, and how we can work together to reduce those claims. And that type of claims utilization is really, really important when you're really trying to achieve minimum cost increases in healthcare. I mentioned to some of you, I've been on calls with other IUs recently, and we have some IUs that are receiving 20 and 30% cost increases for medical claims and prescription drugs. And when I hear those double-digit cost increases, it makes me really, really proud of what we have been able to achieve at BMCS working together with our labor colleagues. So let me tell you a little bit about who's in the consortium. We have 12 participating school entities from across Bucks and Montgomery counties. 5,200 employees are covered and 14,380 individuals. So that's 5,200 employees. And then combined with their spouses and dependents, it's almost 15,000 individuals. Here's the list of the school entities who are members of the Healthcare Consortium. Again, we have achieved cumulative savings of more than 94.8 million since inception. In the 10 of the last 11 years, the consortium has enjoyed renewal rates well below market trend. This is attributable to labor and management working together to make decisions on recommendations made and with our consultant, our administrative fund manager, and our legal counsel. And here are our partners: Delta Dental, Aetna, Capital RX. Our consultants are Oswald. Our legal counsel is Cozen O'Connor, and AMCA is our third-party administrator. Why choose BMCS? We offer 4 medical plans and 6 preferred prescription drug plan options, each with varying actuarial values, streamlining our healthcare discussions at the bargaining tables. One of the chief advantages of being a member of the Healthcare Consortium is you no longer bargain at the table over your healthcare plan designs. That is handled at the consortium level. Labor and management meet together every month. We are educated together on what makes sense for plan design options. And I will tell you, the votes become really, really easy because it makes sense as to what we should do to control cost while still offering quality health care. Our care network through Aetna and Capital RX, it consists of over 13,000 providers in Bucks and Montgomery counties. We are comprised equally of labor and management. Each participating entity has representatives from one labor and one management group. And then we have shared values. We believe in collaborating together. We really work diligently to build consensus. We have transparent communications. We educate our members. Every month we put out emails to members. We have wellness guidelines. We have a healthcare benefit booklets that's available for our members. And we spend a lot of time talking about wellness and health management because it's not just about controlling those claim costs. It's also about helping our members make healthier decisions so that we don't get those high cost claims. And here's some points of, well, here's the numbers again, just to go through them real quick. Overall, takeaway on this slide is we had just this past school year, the Bucks IU saved $633,045 simply by being a member of the consortium. That was in our administrative fees and our stop loss premium. And here are some of the other things we've done each month when we've gotten together and we make decisions about plan designs and plan offerings. We realized when we did a breakdown of our high cost claimants and what our biggest spend was on, a lot of it was on chiropractic care, which is very common because a lot of our employees are on their feet all day, right? They do a lot of standing, they do a lot of bending. One of the things we launched at the suggestion of Aetna was a virtual physical therapy program, which in less than a year, it's showing significant savings and really improving the health of our members. One of the advantages of this virtual physical therapy program is members are not leaving during the school day to go to PT appointments. They're able to do that virtually, and they're able to do that before school and after school and even at 8 and 9 o'clock at night. And it really works well for their schedules. We've received a lot of positive feedback about that. And it's much less costly than other types of chiropractic and physical therapy. we spent a lot of time this past year conducting an in-depth exploration of the impact of GLP-1 drugs. We had a lot of discussions on considering coverage for weight loss drugs. This led to a partnership with Aetna to review, and then we ultimately implemented for all members in the consortium a weight management program to help with our cost of claims and to help with some of our obesity-related diseases. Aetna's program is really good. It allows employees to explore a healthy weight loss experience and alternative treatment methods rather than immediately going to the GLP-1 drug. The alternative treatments include behavior change, nutritional counseling, and coaching before prescribing weight loss drugs. And we've gotten a lot of really positive feedback for that. We've also worked together. I told you to update our mission statement to be able to help better guide us when making decisions impacting healthcare benefits. And then we also looked at patterns within our shared stop loss pool. This was our actuary who helped us understand this data. We reviewed our rules of the road for finances, and we recommended a change that will help protect the fiscal integrity of the shared pool for all districts. And then most recently, the last quarter, we conducted an RFP process for a new pharmacy benefit manager, a PBM, to ensure cost-effective and pricing transparency in what is a really volatile PBM market. And I'm really happy to report we voted overwhelmingly, labor and management together, to move from Capital RX to National Cooperative RX on July 1, 2025. This was a savings of $6.8 million annually. It's a 3-year contract, so over 3 years, it's about a $21 million savings. It is 26.3% less than our current PBM rates. So that was a really significant accomplishment for us. And that's it. That's my report for tonight. Any questions?
Rebecca,
Yes.
the quick question I would ask is, obviously you want to get as many members as possible into the consortium. Is the consortium under its structure limited to Bucks County? In other words, can we seek membership from districts outside of the county?
Excellent question, Mr. Jackson. Right now, the bylaws do say public school entities in Bucks and Montgomery counties. But I was just recently at a statewide PAIU meeting where I told you there were some other districts and IUs complaining about their healthcare costs being in the double digits. And I am definitely very open in next year in exploring expanding beyond Bucks and Montgomery County. We know Aetna and National Cooperative RX are providers that have networks throughout the state and throughout the country, honestly. So we would be very, very open to doing that. Any other questions? All right. Well, thank you so much for allowing me to share with you this evening.
Thank you, Rebecca. Let's move on to our special education mini report, Week of the Young Children. Dr. Greene.
Good evening, everyone. In your orange folder at your place setting, there is a document that Dr. Mitch has prepared about the Week of the Young Child. It's also letter 2B in the electronic version. And I'll turn it over to Dr. Mitch to provide an update on the Week of the Young Child.
Good evening, everyone. 50 years ago, the National Association of the Education of the Young Child, or NAEYC, began celebrating April and recognizing April as the month of the young child. And this was a way to put focus and attention on young children between the ages of birth to 5 years old and their families, and to recognize early childhood programs and services, and also the different staff that work in early childhood programs. Every year, the Bucks IU celebrates the Week of the Young Child, which was last week, April 7th to 11th. And throughout the week, different activities were planned to encourage awareness of early childhood programs, but also to encourage families to come into the programs and be a part of their child's day. Throughout the week, different opportunities to explore various types of learning, incorporating a variety of learning styles were planned for. These days included hands-on, play-based learning, arts, music, and literacy. And on the second page of the mini report, you'll see that Monday was Musical Monday, Tuesday was Tasty Tuesday, Wednesday was Work Together Wednesday, Thursday was Artsy Thursday, and Friday was Family Friday. Families were also invited to be involved in their child's learning through playing an instrument or singing a special song that is special to their family, sharing a favorite recipe with the class, maybe creating a class cookbook. Some came and they were invited to cook with the class. I was at the Upper County Early Learning Center on Thursday, and there was a parent coming in to read a book. And then there was she had planned an art activity to do with the class after they read the book. So it was a nice way to get families involved in their child's learning, get them in the classrooms to see what their child does throughout the day in their classroom and with their friends. Additionally, teachers were invited to create opportunities for classrooms to make posters portraying the life of the young child to be hung in community spaces. So what they did is they worked with the children on creating posters and asked them questions like, what is important in your life? What do you want people to know about the life of a young child? What are your favorite things to do and play with at preschool? So different ways to get that perspective of what it's like to be in early childhood. I would like to ask all of you to bring back this information to your school districts, bring awareness to your school districts and to those at your board meetings about early childhood programs, the importance of early childhood programs, the early childhood environment is kind of unrecognized at times. Early childhood teachers are not recognized or not noticed as much as school age teachers. So this gives an opportunity to give some focus to them. Any questions? Thank you.
Thank
Thank
you.
you.
Excellent.
Okay, moving on to our programs and services mini report, Dr. Holler.
Good evening, everyone. In your orange folder, you'll find the Programs and Services mini report, which is also item 2C on the agenda. This is an overview of the STEELS standards. I'm not sure if STEELS rings a bell to any of you, and in terms of because we have so many acronyms in education, and this is the latest one. The STEELS standard stands for Science, Technology and Engineering, Environmental Literacy, and Sustainability. And those are the new standards that were codified by the Pennsylvania State Board of Education in July of 2022. And there was a 3-year implementation window. So it's hard to believe, but we are at the tail end of that 3-year implementation window. So our team, led by Dr. Lindsay Sides, our supervisor of STEAM education, has been hard at work over the past several years now, supporting your districts in preparing to implement the STEELS standards. As you can see from the mini report, we have led a variety of opportunities for professional learning, from supporting STEELS leadership teams to having different sessions like STEELS 101, 201, and 301 to give all of the folks that are supporting teachers within the classroom how to be prepared to implement those new standards. On the back of the mini report, you'll see other ways that we have been supporting the opportunities related to STEELS. We've held 2 different STEELS resource fairs in which different vendors have been here in the building to provide different ideas for how to implement different materials, curricular resources, and programs to be purchased. And we've also provided a number of additional professional learning opportunities, including an Environmental Literacy Institute and what's called MIWI, the Meaningful Watershed Education experience training, among others. So this has been a journey, and we're looking forward to continuing. It was not that support ends after the 3-year window, but we will continue to refine and get feedback from districts in terms of what's working well, what needs, what requires more support. For those of you, when you think about the K-12 continuum, there has been some shifting that's taking place right now. PSSA testing is upon us and will be starting next week in your elementary and middle schools. And so what traditionally was the 4th grade science assessment is now 5th graders taking a pilot this year. Also in 8th grade, students will be taking the pilot of the assessment. So this is the first opportunity that students will have to actually, to see what kinds of questions and what they look like, and being prepared to be assessed on that material officially starting in the next school year. So that's just a quick overview of the standards and what we've been doing as a Bucks IU team to support the work that's happening, on the ground in your districts. So do you have any questions?
Dr.
Go ahead.
Dr. Holler, there was, when I first got on the board, there was STEM, science, technology, engineering, and math.
Mm-hmm.
And a couple of years ago, they made sure the A was in there. Let's get arts in there. Now we have steels. Are they different? STEM and STEAM are pretty much the same thing. They just added arts, but is this different than those, or is it just the latest iteration?
That's a great question. So I would say I would put them in 2 different categories. We have the STEAM, and that's all the work that we do to support things like the mobile Fab Lab Center, et cetera. The STEALs are the specific standards that are being assessed in essentially the science classroom and beyond. And so that they're based on the next generation science standards, and it's really designed to provide 3-dimensional learning for science. So while they're connected, I kind of put them in 2 separate categories. We have the standards that are very specific to the classroom experiences, and then we have STEAM that we hope that everything goes beyond the classroom, including the STEAL standards. I think that the STEAM category, or that STEAM concept, really extends to all sorts of aspects of students' learning that you might see, I'd say across the school day, but then also where we're able to provide support from a mobile Fab Lab and Fab Lab Center kind of perspective.
And this was enacted 3 years ago, but just now rolling out as you got to begin implementing it.
Yes.
Are they already working on the next way to shake up things and give you something new to do?
That's another great question. So as the state board does have some standards that are already in process. So right now there's another window of a multi-year window related to the personal finance standards and the personal finance course that is required at the high school level. In addition, there are career education and work standards that are right now in that window that will be implemented fully in 2026. And there's now talk of new standards that will be looked at, and I shouldn't say new, but they'll be doing revisions to the health and physical education standards, perhaps others. But so we continue to see the state board, taking a fresh look, and that's good in many ways, that we're looking to refresh and make sure that the standards are staying current. But it does require a lot of extra, work in the curriculum departments or curriculum areas within all of your districts to be able to implement those changes.
Mr. Jackson, that was the exact same question that I was going to ask, but I will follow up with you. So you mentioned that now there's going to be some testing in the 5th grade.
So the way it used to be until this current year is that students in 4th grade and 8th grade were tested in science. So that 4th grade test is done.
Okay.
It is not occurring this year. The 5th graders in your buildings will be taking the science pilot assessment, and then moving forward for the 2026 year, your 5th graders, that assessment will no longer be a pilot. It'll be something that would count.
And the 4th grade is done.
The 4th grade is done. Yep.
Okay.
So the 5th graders get to take it twice, 2 times in a year,
Yes, and in
right?
fact, several of the people on my team, including my very own son, are in that special cohort that gets to take the test last year as a 4th grader and this year as a pilot. He is thrilled, and as are several of our children in the Program and Services Division, to get another assessment this year.
Well, and
They
that's
deserve
not-
some ice cream, Dr. Holler.
But that's not
Maybe.
necessarily a bad thing, right? Because, on these longitudinal testings, right, you're testing a different class of kid. But when do we ever really get to see a year over year? Not that you could do it like as a direct linear correlation, right? But it would be nice to see the same kid being tested on similar subject matter to see if the mix of the scores is skewing in a positive direction. We don't have that now, right? It's always a different class of kids taking the test.
Sure.
And there's nothing to compare that to for and aft, correct?
For science, it is a little unique because there's those gaps for the math, for the English language arts reading. Those actually we can compare year over year. There's something called the Pennsylvania Value Added Assessment System, probably a topic for another day. But that idea that their students are being like kind of compared year over year for those content areas. But for science, there hasn't been. They use the value added assessment system to make projections on students. Likelihood of being proficient in the science exam, but to your point, you do not have the year to year comparison. Yeah.
Thank you.
Sure.
Okay, moving on. Dr. Hoffman, Executive Director's Report.
For those board members interested in what to talk about when you're at your home district meeting and it's the time for the IU report, your orange folder and also board docs contains all the information that should brief you for an effective, impactful intermediate unit report, including the slides that Rebecca just shared related to the healthcare consortium that the intermediate unit is a part of with IU specific data. There's a one-pager in there that also has the information on one sheet. You see Dr. Mitch and Dr. Graney's early childhood report, the week of the young child, the month of the young child, the Steele report that Dr. Holler just reviewed. And then, of course, I believe I shared this with you via email, open to board members and, of course, IU staff, is our graduation of our graduating class of intermediate unit young adults this June 9th at 6:30 at Del Valle University. I hope you're all able to attend. Your district administrators, of course, have been invited, and it wouldn't be the same without our board. So we hope you're able to attend. Del Valle University as a gracious host, supporting intermediate unit graduation activities, a highlight of the year. One of the many highlights, I should say. The Project Search Intern of the Month. I always like to read a sentence or two. This is John. John's been very successful in Project Search, and I like this this profile towards the end. The beginning talks about John's work throughout the county in Project Search, but this last sentence I just like because it's about John beyond his internships. It says, beyond his internships, John is also honing his independent travel skills in Doylestown, confidently navigating trips to local spots. His commitment to personal and professional growth is inspiring. I just love that. I love that sentence. And I love what it reveals about the relationship he has with his teachers and his staff and just the success he's finding in Doylestown through Project Search. You have your awesome news. The awesome news is back. Everything that's fit to print related to the intermediate unit over the last 30 days. I'm always amazed when we go through this, that this is just what's happened since we last met. I won't read it to you, of course. I encourage you to look at things like things happening at our Fab Lab Center, activities that impact literacy across intermediate unit programs. It's the month of the social worker and the press release that we put out that was picked up by various outlets recently. Some great things happening in early childhood programs. Karen Sandone, there she is, bottom of page 2, being recognized and nominated for her outstanding human resource work through the Delaware Valley HR Consortium or Professional Association of HR Directors. Congratulations, Karen, on being nominated. Well, I know you want. Karen said she wants to win. So it's not just an honor to be nominated? Okay. We want you to win too. Is there some way we can stuff the ballot or something like that? Vote early, vote often? All right, very good. We're pulling for you, Karen. And that's well deserved. We're proud of you. Even if you don't win, you can still come back to work. All right. Thank you. There's some great things happening every day. It's a national day of something, and the IU is so diverse and so inclusive in what we do that we celebrate so many of them. And just on page 3, you see some of just the amazing things that touch the intermediate unit, as well as on page 4. Some highlights on page 5 related to professional development, just not only for IU staff, but for district staff that we facilitate, both here at the IU and in your districts, as well as throughout the IU in our own programs. some highlights from our Monday moments about the zoo visiting Samuel Everett, to preschool early intervention, to kindness and inclusivity, safety focus of the intermediate unit. Moving on to page 8, our legal breakfast with Ellis Katz and Mike Levin for school administrators. The youth center getting an amazing award, some family projects, recruitment, retention, and just so many other amazing things. I encourage you to take a look and use some of that as inspiration for your report about the great things happening here in the last 30 days. Rebecca's legislative report is also included in your folder, and you've, of course, if you've been following my updates, just a moment to say that we continue to advocate for Head Start funding. Our Head Start grant expires at the end of May. We're still awaiting words from the Federal Office of Head Start about the status of our application, as are all grantees, to my knowledge, that are in the same 5-year cycle as we are. And I believe as any Head Start grantee that is in the middle of a cycle awaiting formal notification that they'll be funded for next year. Just a reminder that we serve nearly 400 families in Head Start and Early Head Start every month. There is a board tab related to our Head Start update, and Dr. Mitch facilitates that. And this month is no different than any other month. You see the policy council minutes, and you see the amazing work just in a snapshot in that book that occurs across Bucks County for Bucks County families and Bucks County students that will ultimately be served in your schools after they're kindergarten ready. So they transition from IU Head Start programs from Bristolboro to Quakertown, from Centennial to New Hope, everything in between, into your kindergarten programs. And so we continue to advocate with our federal legislators because this is a federally funded program. So we've been in touch with Senator Fetterman's office, Senator McCormick's office, and of course, Representative Fitzpatrick's office. We're hearing back from most of them about their advocacy efforts on our behalf. They can't promise anything. They don't make the decisions themselves, but they can at least call the Office of Head Start on our behalf and advocate for the nearly 400 families in Bucks County that this benefits. Financially, it's a $5.8 million per year annual award that we've applied for. So this is about a $30 million program for the IU over the life of the 5 years. And it impacts a plethora of staff across Bucks County, both at the classroom level and at the administrative and support level, to the tune of about 80 or so employees. And so this is something that we're very proud to have been facilitating for the last 10 years. And it's something that I would ask that all board members and all intermediate employees join me and the administrative team and our Head Start team in advocating with our federal offices about the importance of Head Start and about the impact it has on Bucks County and about the impact that it has on school readiness for children throughout our amazing county. If we don't hear back before the end of next week, a small team of us intend to meet with our federal legislators and their aides early in the following week in Washington, D.C. to continue to advocate. I'm also advocating and trying to coordinate an intermediate unit level intervention at the state level for all IUs that facilitate and operate Head Start programs. It's not all intermediate units, but it's many. And so I believe that if we focus our energies into one voice, it'll be a little louder than if we're all just sort of working at it on our own. So that's my ask to board members and to IU employees, that you advocate with us and that you tell our federal legislators that the Head Start program is important and that the Bucks County stewardship of that program deserves another 5 years.
I just had a couple things. Our friend John, intern of the month, he's been basically all over that county courthouse, correct?
Yes, sir.
He's been now he's in Behavioral Health. He was Hub, Board of Elections, Prothonotary Department, and I mean, he's got to be like really one of the key success stories. And
one of many, yes, sir.
Yes, one of many. But we just like to thank the county because they went out on a limb, right, to join and partner with us, and this thing is really becoming hugely successful. So much credit. And Karen, congratulations. And your nominations for things you did in the past, right? But I look and see, like for instance, what we're doing now. Like you're having to staff, and we're hoping to staff up already for next year. And you guys are, I saw you had something at the community college, or did you have a job fair recently? Yes, that's right. That's where I saw it. And that's, like John Dillard just said, right? Go where the money is, right? Go where the teachers are. So it's a great impetus by you to go out there and really, really pound the pavements. And that's gonna work out good because I know we are anticipating the need for to fill a lot of new positions as many of our programs are in the process of expanding and relocating. So congratulations again.
I just had one question. What's your backup plan? If you don't get the funding?
If we don't get the funding, then the program can't operate. And it might be a little different if we're in the middle of a 5-year cycle. Perhaps the IU would float it and make it up on a reimbursement from the federal government. The unique position that we're in with 6 other grantees in the state of Pennsylvania is that our 5-year award ends. And so our credential, if you will, to operate the program expires on the 31st. It's not like we're in the middle of a grant award and we would decide as a board if we want to continue to operate absent the money. So we wouldn't be authorized to operate the program anymore.
When is that? June?
May 31st.
May 31st?
So I'm telling everybody, this isn't something that is we control. It's something that others control. And I'd like as many people as possible to know so that they can advocate with us and so that no one can say they weren't aware in the event that the program is not funded. It's important.
Okay, moving on to item 3, public comment. Karen, anyone from the public? Okay,
That's a no.
That's a no. Okay. Okay, moving on to our consent agenda. I'll ask everyone to take a look and we're specifically voting tonight on items 5A through 10D. So I would ask you to look through. Many of you have already. And does anyone have any item pulled or wish to have it voted on separately?
Could we take the minutes and vote on them separately since I was not here? And I would be abstaining from
Hey,
that.
what
The
do we
minutes,
Just the minutes,
Just the minutes?
just the minutes.
Can we do that?
I defer to the,
Yes, you can. You can have a motion to approve the minutes and then Mr. Goddington can abstain
Okay, so-
from approving those minutes. And then you can have a second motion, which would be item 5. I guess it'd be item 6A then
Yeah.
through
Forward.
10D.
Okay, so we'll put that motion on the floor. Can we motion to approve the minutes from the prior meeting? Can I get a motion to do that and on a roll call vote?
That would be
Motion to
item.
approve.
Mr. Waldorf,
Okay,
Second.
that's item 5A.
Ms. Foley seconded.
Yes, it's items 5A and 5B.
Okay, so items 5A and 5B, we have a motion
And a
to
second.
vote on them second and a second. You have the names?
She does.
Okay,
Any discussion?
so is any questions or concerned about those minutes? Okay, so can we get a roll call vote on that?
Is a roll call necessary or is consent? Or you prefer the roll call?
Well, I prefer.
Oh, because he's going to recuse. Thank you, sir. That makes sense.
Okay,
Mr. D'Angelo,
yes.
Ms. Foley,
Yes.
Mr. Godikson,
Abstaining.
Mr. Hollowell,
Yes.
Mr. Jackson,
Abstaining.
Ms. Oseki,
Yes.
Ms. Walbeezer,
Yes.
Mr. Waldorf,
Yes.
Ms. Winters,
Yes.
Mr. Wers.
Abstain.
Okay, 3, 4, 5, 6, 7. So
Okay,
have
we
a-
got it?
Yep.
Okay, that motion carries. Okay, moving on to, we're gonna go now to items 6A through 10D.
Correct.
And that will be a consent agenda. And again, does anyone have any questions or needs to have something pulled from that? I'll take that as a no. So item 5A through 6A through 10D.
You
Can I
need
get a
a,
motion?
So moved.
Scotus?
Second.
Second by
Wertz.
Mr. Wertz. Any questions or concerns about that? I'll take that as a no. All in favor?
Aye.
Any nays? Any abstentions? And that motion carries.
Thank you.
Okay, moving on. We'll go to our legislative report. And that would be Rebecca.
Okay, good evening, everyone, again. The legislative report is in your orange folder. It's also in board docs. I'll begin on page 1. I gave you the scheduled session days for both the House and the Senate. Please be aware that neither are currently in session. The House will reconvene next Tuesday, April 22nd at 12 noon. The Senate will reconvene on Monday, May 5th at 1 p.m. There's not been a lot of bills introduced relative to education, so I really don't have any update for you from a legislative perspective, but I do have some updates for you across the state. So the first update are the special election results. As you know, there was a special election to fulfill the 35th legislative district seat, which is a seat in Allegheny County. There was an unexpected death in that seat in December, and the special election occurred in March. It was won by a gentleman by the name of Dan Gonauer, who is a school director in the McKeesport Area School District. This formally gave the Democrats the formal majority in the Pennsylvania House, keeping the numbers at 102 to 101. Surprisingly, on the same day in a special election in Lancaster County, Democrat James Malone unexpectedly defeated Republican Josh Parsons, which makes the Senate now a little bit narrower than it was. The Republicans still hold a majority 27 to 23.
Hey, Rebecca, before you go any
Yes.
further on those two, so they were special elections, so they're just to complete the term of somebody and then, so those, that
Correct.
legislator will have to run again the next cycle, right?
That's correct.
And both in the House and the Senate, correct?
Both in the House and Senate, those members were elected to fulfill the unexpired term of a member who passed away and a member who I believe left the Senate to go work for the U.S. Senate. All right, in the middle of the page, late liquidation of COVID relief funds. I know some of you have been reading some communications about this. On March 28th, the United States Department of Education issued a Dear Colleague letter stating that the department would no longer honor any previously approved late liquidation payments for expenditures of COVID relief funds. The letter indicated that the cessation of payments would apply both to local education agencies and state education agencies, such as PDE. On Thursday, April 9th, last Thursday, the Pennsylvania Department of Education shared information about the impact of this rescission on Pennsylvania LEAs. In total, PDE reported that there's about $185 million in COVID funds that were approved for late liquidation to school districts, charter schools, IUs, and CTCs across the Commonwealth. These funds included American Rescue Plan funds distributed as part of the ESSER Relief Grant, Emergency Assistance to Non-Public Schools, the EANS Fund, and the ARP Homeless Children and Youth Fund. Taken from the spreadsheet that PDE issued last Thursday are the Bucks County school districts that were identified as having an LEA late liquidation balance in Bucks County. You will see it was Surprise, Bucks IU, Central Bucks, Penridge, and Pennsbury. Please understand that this was news to all of us because none of these identified districts had applied for late liquidation. Every Bucks County district on that spreadsheet issued by PDE had all confirmed that they had submitted on time for those grants. And in Bucks County, it all fell under the ARP HCY grant. You can see that for Bucks County IU, we were listed as having a balance due of $933,000. We didn't have any record of that amount of funding still due. So we and the other LEAs in Bucks County believe there was a possible discrepancy by the state in the amount listed as owed. And again, none of the LEAs in Bucks County were aware that our submissions were considered to be late. And we believe we met all requirements for on-time reporting for the grant submissions. I understand that actually, even though we did not submit late, the state, PDE, has submitted these requests to the U.S. Department of Education under late liquidation, and they were approved. Apparently, the 185 million had been previously approved for late liquidation. As far as we are aware, and Allison and her team, Emily, did a great job trying to track down these funds. We are still owed $736,206.70 attributable to the ARPHCY grant. And we believe that that may be the actual amount that should be in the state spreadsheet. So there were LEAs across the state, not just in Bucks County, that began questioning the amounts in the spreadsheet issued. So PDE then has reached out directly to each affected LEA, including the Bucks IU, asking to complete a survey so that the state could more accurately recover and describe the approved funds. So we are still waiting for feedback from the state. We were all on a call with the state today. The deputy secretary was on that call and answered some questions. Please also know that PDE announced last week that the Shapiro administration is joining with 15 other states and the District of Columbia to challenge the administration's rescission of what had previously been approved as late liquidation of COVID relief funds. I listed at the top of page 3 for you all of the states that have joined in that litigation. That includes New York, Arizona, California, Delaware, Hawaii, Illinois, Maine, Maryland, Massachusetts, Michigan, Minnesota, Nevada, New Jersey, New Mexico, Oregon, and DC. I also wanted to make sure you were aware Governor Shapiro joined this lawsuit in his official capacity as governor of the Commonwealth of Pennsylvania. This lawsuit was not filed by Attorney General Dave Sunday. In the middle of page 3, I want to provide a federal update for you on the Title VI attestation clause. So I know some of you may already be aware of this, but on April 3rd, the U.S. Department of Education sent letters to all state education agencies, including PDE, requiring state education agencies to certify compliance with Title VI of the Civil Rights Act and also compliance with the responsibilities outlined in the Supreme Court opinion found in Students for Fair Admission versus Harvard. This case, if you're not familiar with it, made it clear that schools and universities cannot use race as a grounds for admission or for other selection practices. The Dear Colleague letter required each state SEA to report on their state practices and also collect a signed certification from each chief school administrator of each LEA in the state, acknowledging their legal obligations under Title VI and the SFA versus Harvard case. And it provided a 10-day deadline for compliance. That 10-day deadline was later extended 10 more days to April 24th, 2025. On Wednesday, April 9th, last week was a busy week, PDE sent a letter to the U.S. Department of Education noting that PDE has and will continue to abide by Title VI as confirmed through all of the underlying grant agreements for receipt of federal grants. The communication indicated that the letter served as Pennsylvania's certification and that Pennsylvania will not be requesting individual LEAs to certify their compliance. In the transmission of the letter, PDE made it clear that no further action will be required by LEAs at this time. That letter was intended to relieve LEAs of the need to complete the attestation form. And I provided a link where you can actually see a copy of Acting Secretary Rowe's letter. So if you go into the digital copy in Board Docs and just click on that link, it'll take you right to Acting Secretary Rowe's letter. In the meantime, the American Civil Liberties Union, ACLU, the ACLU of New Hampshire, the ACLU of Massachusetts, the National Education Association, NEA, and NEA of New Hampshire filed a lawsuit in U.S. District Court in New Hampshire challenging this USDOE requirement. The lawsuit specifically challenges the directive on multiple legal grounds, including the fact that the lawsuit alleges the U.S. Department of Education overstepped their authority by imposing unfounded and vague legal restrictions that violate both due process and the First Amendment. The parties to the lawsuit reached agreement with the administration that the U.S. Department of Education will not take any action regarding the certification against LEAs and SEAs until after the April 24th deadline. And then this will give the court time to hear the preliminary injunction arguments filed by both the NEA and the ACLU. Arguments are scheduled in this case for April 17th. And then finally, at the bottom of page 3, President Trump signed an executive order on Thursday, March 20th, that would direct the Secretary of Education to take all necessary steps to facilitate the closure of the U.S. Department of Education and return education authority back to the states. The executive order aims to minimize the federal role in education, but it stops short of completely closing USDOE, as that would require 60 votes in the Senate. So the order directs the secretary to ensure that the department continues to deliver services, programs, and benefits, but it does indicate the president's preference is for critical functions like distributing IDEA funding to be the responsibility of other agencies, such as the Agency of Health and Human Services. That's it for my report. Does anyone have any questions?
I guess my only question would be as far as these funds that we're owed. So it's kind of like, we're thinking we're in the right. It was just a clerical or administrative error. Like they're saying that they're not going to pay these funds because they were submitted late, but actually our funds were actually submitted on time, the 700,000, correct?
Our funds, along with all school districts in Bucks County, is my understanding, all were submitted on time. No one made a request for late liquidation.
Okay.
But what I believe happened, and Dr. Hoffman has been talking to the secretary, I believe what I believe happened is, even though we submitted on time, PDE was approved by the U.S. Department of Education back in late November, I believe, that they could submit that 185 million through the late liquidation process.
Okay.
And Dr. Hoffman, do you want to talk about that? Because you gave a really
That's it
good
right there.
explanation.
That's it. When I originally saw the list, I thought, oh, we're on the naughty list. What did we do? What deadline did we miss? Because it appears if you look at the list, whoever's on the list must not have been compliant. That's not actually the case. We were compliant. We met every deadline. We met every deliverable, and we submitted everything on time. It made it to PDE. PDE had an agreement with USDOE to be able to receive the money after the grant period through late liquidation. And it appears that agreement has been reneged or undone, hence the
Rescinded.
lawsuit. That's the best understanding that I have.
Thank you.
'Cause the matter is between, in other words, the matter is between the United States Department of Education and the Pennsylvania Department of Education. We are collateral damage. Our 900,000, our 733,000 is a collateral, is an unintended outcome of a dispute between the departments of ed at the federal and state level.
Right, but they should be able to work it out, right? If we know we did everything and complied, I mean, it's not
Well,
like,
they're going to work it out in a lawsuit between
Well,
15 states and the USDOE.
right, but my
So-
point to you is, it's not like they had allocated that money and that money was there to spend. And it's not like that money's not there at the federal government level in the COVID allocation.
Yeah, I'm sure the money is there. I believe the United States Department of Education's position is that they no longer intend to honor the previous administration's intention to honor late liquidation. At least that's what I understand according to newspaper articles I've read. That's not through any direct source.
That's correct.
Three-quarters of $1 million, that's a lot of money, right? And then
It's 181 million or so across the state of Pennsylvania,
185 million.
185 million. So we're a small percentage of it,
we
but
should be.
that's a lot of
confident
money.
that
We've
we'll
spent
get
that
it.
money, by the way,
Yeah, we spent it, right.
and we submitted for the reimbursement.
So we're just gonna keep an eye on that lawsuit and it'll probably end up getting settled somewhere down the line.
Yeah, arguments are on April 17th, as I stated, and I will continue to update you as information becomes available.
Thank you. All right, moving on to again, we didn't have we previously announced the board met in executive session to discuss personnel and real estate. Item 13, any old business?
John, you're old.
I know. I'm getting older every day. I'll take that as a affirmative. Any new business? Okay, again, I just would say, please put this close by and I hope that everyone can attend. It's the highlight of the year. And it's the gift that keeps on giving. And you have to go, once you go, the following year, it always outdoes itself. So if you haven't been there, you got to start because each subsequent year, it's a way better event. Thank you.
Mr. D'Angelo, I'm sorry if I may, on Friday, May 2nd, we have the prom here. So
Oh.
everyone is invited to stop by for the prom on
Absolutely.
Friday, May 2nd. It will be before our next board meeting on May 18th, I think it is.
Yeah, can you send me something I can send to them?
Sure.
Yes.
Yeah, thanks. Good
Yes,
reminder.
Please, that's another one.
And then
Yes.
there's the project search banquet, which I've sent to all of you. Several of you have RSVP'd. So, I mean, we're gonna be having a lot of meals and celebrations together.
But again, the prom is also, I think last year was maybe my second, but wow. If it's any better than last year, again, you have to see it to believe it. And it's just everybody, so many people from the staff that coming and giving their time and actually having just as good a time as the kiddos that attend. So that's the hopefully you can make that prom. Okay, Karen, any public participation? Anybody come in late?
No, she's
Nah.
saying no.
Well, it would help if you unlock the door.
Okay, so now for the record, the door is not locked.
For the record, the door is
For
not
the door,
locked.
for everyone watching at home, the doors are wide open,
Okay.
or at least they're unlocked.
Just a reminder, we will be meeting on Monday, May 19th. Again, we have a couple really great events in between. So I hope everyone can join us, even if it's just for a half hour or so. But anyway, other than that,
Mr.
yes,
I'm sorry, Mr. D'Angelo, we just know that next meeting is on Monday, May 19th. It's not on Tuesday.
yes, Monday.
Tuesday is primary election day. So whenever there are election years, we meet the Monday before.
Maybe we can do an early poll for quorum. Just to make sure that folks have that on their calendar. Maybe we can do it earlier than we normally do.
Great idea, but just put that board
Move your
member.
voting up to the front.
Pardon me?
He's suggesting moving the
Yeah.
voting to the front on Monday, May.
Of Monday? Yeah, we
Yeah.
could do that.
It's the day
May
before,
19th.
1/9. Okay,
So what we're gonna do is try to get in early, Michelle, early if we can get, and we'll get all the voting out of the way. And also just get the agenda and all will be a day earlier so people can look at it. Great. All right. Good stuff. With that, can I get a motion to adjourn?
So moved.
Ms. Foley,
Ms. Foley, second.
that was Mr. Hallowell.
Mr. Halloway, meeting adjourned.
Thank you, Mr. Hallowell. Ms. Foley.